this legislation will ensure that in Connecticut, regardless of what happens in Washington, women's health care will continue to be protected. We will be maintaining access to well women visits, breast cancer screenings, screenings for sexually transmitted diseases, breastfeeding supports, and other important health screenings, as well as access to contraception for women. This has been a really exciting process and conversation that we've had here in Connecticut with so many people coming forward and supporting making sure that in Connecticut, women's health care will always be protected. We're proud to have bipartisan support, and they've had a really good conversation in the insurance committee on these issues, and I'm hopeful that later this afternoon this bill will get broad support.
Enacting this bill will mean that, as others have said, that no matter what happens on the federal level, and it certainly doesn't sound as though the bill that's been introduced the other day has a great, bright future. It certainly has a long road ahead of it, if nothing else. That women in Connecticut would have access to no-cost contraception, and the bill would extend coverage, as did the Affordable Care Act, to sterilization procedures and the range of preventive screenings for STIs, sexually transmitted infections, breast and cervical cancer screenings that are really basic to the health of women and their families and their partners. It would cover the full range of FDA-approved contraceptives, and lest you think we're out in front of the pack, which to some degree we are, there are several states that have already enacted this very sort of legislation prior to the election, in fact: California, Illinois, Maryland, and Vermont.
We have improving outcomes in terms of women's health, in terms of maternal health, especially around things like a falling rate of unintended pregnancies, which we know has broader outcomes not just for women, but also in terms of child health. And what this piece of legislation will do is ensure that we don't start to go backwards in terms of narrowing some of the significant health disparities that still exist in our state. So access to contraceptives, access to basic health screenings around cancer, around domestic violence, and also access to prenatal care would all be something that women can access no matter what kind of healthcare plan that they're on, regardless of cost. So it's really important that we keep in place what we have, and that, as we see from the group of legislators that are here and who have supported this, that we have strong bipartisan support to keep moving forward in Connecticut, to look at where our continued health disparities lie, and to keep making progress on those instead of taking any steps backwards.
Today is a very important day. It's a day that we can tell Connecticut women to rest assured that the benefits that they have been afforded under the Affordable Care Act will continue no matter what, as Senator Flexer said, happens in Washington. And this is not a Democrat or Republican issue. This is a bipartisan issue where Democrats and Republicans are coming together on behalf of half of the population of Connecticut to make sure that the things that Senator Flexer mentioned that are common sense, basic rights of health care for women are protected.
And because of you and because of your support of the people who love you, we are here today with that bipartisan support, believing that this bill will be passed out of committee. So I agree with everything my fine colleagues have said, but I did just want to dovetail that with one thought, that we are here because we're listening to the women of Connecticut and the people that love them.
But when we talk about women's health, I think we all know we're really talking about health of our families. And I think we all know it's really important. I'm proud to be here. What I think we're trying to say here is this is not a Democrat or a Republican issue. This is family issue. This is women's issues. And I'm proud to stand with my colleagues here today to support